All right.
Okay. All right. Good morning, everyone. Thank you for tuning in for this seminar. My name is Evan Amell. I'm the head coach and owner here at EA Fitness and Performance. We are a personal training studio located in Falmouth, Maine, right across from the Falmouth Hanfords. We offer personal training, small group personal training, online fitness coaching, and nutrition counseling. So basically today what we're going to go over is we're going to go over back pain because there's a lot of different causes, and then go more into further detail in terms of how you can actually prevent that. So I got my good friend here, Dr. Phil Finemore. He is founder of Work Fit Me Mobile Physical Therapy, and he's here to help busy Maine professionals improve their physical performance so they can live a happy, healthy, and wealthy life with their loved ones. He is passionate about helping people ensure their number one asset in life, which is their body and their health, gives them the biggest return on investment, which is an abundant life, doing what they love with who they love. Without further ado, here is Dr. Phil Finemore.
Evan, thank you very much for that. I appreciate that. It's almost like I wrote that or something. You knew exactly what to say. No, kidding. Thank you very much, Evan, for hosting this and kind of collaborating so we can get the word out to more people and share some of this information this morning. I really appreciate that. So as Evan alluded to, we're gonna be talking about. I really kind of almost like to approach this as sort of like myth busting some things about back pain, because you hear, you see a lot of things out there where, people are sharing articles or posts around the internet about how to treat sciatica, how to treat back pain and all this stuff. And the some of those can be very helpful, but the problem is not all back pain and not all causes for sciatica are the same. And that's where we can get into trouble with these sort of um, blanket articles or informational posts where they're offering these quick fix solutions for back pain. And some of those things for certain people might work brilliantly, but some of those things within that same article might actually make that person's pain much worse, or turn it from localized back pain into sciatica and things like that. So I'm always pretty quick when I see stuff like that to go, hey, wait a second, be careful, because what you're doing might actually hurt you more than help you, depending on what's going on in your specific situation. So that's kind of the bulk of the information I want to get out there with this today is what are some of the different causes of back pain? How do some of those kind of present? And then some just daily habit and body mechanic changes that you can make that can help prevent some of those things, which will lead into some ideas for treatment and everything as well. So again, thank you all for being here. And how I want to start today is I'm actually going to go into a little quick screen share, because I just want to go over a little bit of just some basic anatomy, so that as we talk about certain things, we're all just sort of familiar with it, and it's not like I'm speaking Chinese here. just all of us get familiar with what we're looking at. So I'm just going to share my screen here really quickly. Pull up a couple of things. So can you all see both of those pictures? Yeah, good, awesome. So we're going to start over here with this one, which is just the basic side view of the spine. So we have 7 vertebrae in the cervical spine, which is your neck. We have 12 vertebrae in the thoracic spine, which is your mid back. And then we have 5 vertebrae in the lumbar spine, which is your low back. This bone down here is the sacrum, and your tailbone, which is your coccyx, sits right on the bottom of that sacrum. So you can see we have a nice natural S curve. That's the natural alignment of the spine right there. Each one of these vertebra has joints on each side, left and right, with the vertebra above it and the vertebra below it. So you can see that in these facet joints over here in this photo here. These are the facet joints. So that's how our that's how the segments of our spine actually move. So that's how we bend, twist, rotate, all that good stuff. In between each vertebra, we have a disc, which is our shock absorption. That's what spaces these vertebrae out, gives us some nice cushion in between each of the vertebrae. Those are made up of a very thick outer layer, a very thick, tight woven connective tissue. And inside, it's kind of like a jelly donut, actually. Just the outside's a lot harder than an actual donut. Is anyone else hungry now? Okay, I shouldn't have said donut. Sorry. But the inside is more of a jelly-like substance. There are also a lot of ligaments. Those aren't shown as well in that picture, but our spine is a very stable structure. So there's ligaments that are on the front of the spine here, ligaments on the back of the spine here, ligaments that go between these little processes that come off here, ligaments that go in between all of these little protrusions off the back. So it's a very strong and stable surface. And then you've got a whole bunch of different layers of musculature in there as well. The final thing to kind of really go over here is these yellow things right here are the nerve roots, okay? So these nerve roots come through these openings in the spine, which you can see some of these openings over here as well. And they come directly off of the spinal cord, okay? All these nerve roots then form together in different combinations and ways to actually form all of the nerves that go to all the different places in the body. So if we're looking in the lumbar spine here, the low back here, the nerves that come out of L3. Yeah.
We're only seeing the diagram, spinal column.png.
Oh, okay.
Your cursor was on just a second ago. Is there a second visual?
Yes. Let me thank you for letting me know. Let me stop.
I just sort of realized you were describing something I wasn't sure we were seeing.
Yep. Let me share this. Are you seeing this one now, the lumbar spine?
Yes.
JPEG? Okay, let's go off that.
I knew it was something wrong when you were talking about yellow and there was
yeah, and you weren't seeing yellow. Yes, thank you for letting me know. Yes, so let me go over that again. So the yellow things here are the nerve roots that come off of the spinal cord, okay? So when we're talking about the low back here, the sciatica is the big thing people talk about in the low back. The sciatic nerve is made up of the nerve roots from L3, which is up here. You can't really see on the picture. The nerve roots at L4, the nerve roots at L5, and a little bit off of S1, and those nerves aren't shown in the diagram here. But all those individual nerves come out, and then they form together to create the sciatic nerve, which goes down the back of the hip and all the way down our leg and ends in our feet and our toes. So that's kind of I like to bring that up because that's kind of the biggie. That's what a lot of people have problems with, and it's one of the big questions that a lot of people have is, how do I treat my sciatica? So that's all the basics there. I'm going to stop the sharing. Everyone get a pretty good grasp on that, was able to see that and everything. Fantastic. Awesome. So as we just went over, there are a lot of different structures in that area. There are also a ton of nerves, because even though we just covered those specific nerve roots, there are tons of smaller nerves that come out and just go locally to the spine, because they have to control the muscles that are around the spine, the sensation that's around the spine. And there's a lot of nerve tissue that comes out of those openings. That is a big reason why back pain in general, no matter what the cause, tends to be so sensitive and tends to be something that really kind of scares people and makes people uneasy when they feel it. The spine, like many areas in the body, is an area where the amount of pain that you feel is usually not indicative of the amount of damage or injury that's in the area. Another example of that is like an ankle sprain. Okay, when we roll our ankle or sprain our ankle, it continues to hurt for a little while, but that's not because the ligament that was sprained is continued to be damaged or is getting damaged more, right? It's because something that isn't feeling normal or had a quick force applied to it now has more stress placed on it that it can't support well because it's healing. So the damage is not necessarily getting worse. It's just that area isn't feeling quite right and is having more stress placed on it. So same thing in the spine, but we feel it a little bit more, and it affects more of what we do because our spine holds us upright all day. And there are a lot of nerves in that area that can then get sensitive to the stress that's being placed on them. So we tends to feel a little more sensitive for us. And we have a bigger response to some of that. If I'm going too quick, please jump in, ask questions, slow me down a little bit, throw questions in the chat as we go. Would love to answer any questions people have as they pop into their head. So I want to talk about 3 main areas in that spine that cause pain, that most frequently cause people pain, whether it's in the back or whether it irritates nerves and it radiates to other areas such as sciatica. The 3 main areas are muscle strain or spasm, disc bulges or disc herniations, and stenosis or arthritis, basically. So we're gonna kind of cover all 3 of those, kind of how they happen and what you tend to feel when they happen. So the quickest one, the one that's not quite as common in today's world, is that muscle strain and spasm. The typical way that happens is our muscle strain, our muscles in the spine usually are put on a bit of a stretch, like we're bent over, or we're in like a partially bent position with our arms or something out in front of us. And then we lift something, or we kind of twist at the same time, or twist quickly or move quickly. And those muscles that are in a not so great position have to now work and stabilize us really quickly. And they're doing so with a poor mechanical advantage. So a good example of this is if you're holding a gallon of milk, do you hold it in close to you, or do you hold it out here? In close, right? It's way harder out here. So when we put muscles in our back by being partially bent and trying to lift something or hold something, or we do like a lift and twist from a bent position, we're taking those muscles that are stretched out, putting a load on them and asking them to work. And that's how we strain that muscle. Okay, so that's typically how something like that happens. The hard part with that is some of that can also be a way that a disc herniation or disc protrusion or disc bulge can happen. However, usually a strain is a kind of a combination of a twist component as well. So there are some ways to definitely differentiate that, and we can also do that through some examination. It is possible to differentiate those things out, but we just in day-to-day life, we tend to put our back musculature in some not so favorable positions and then ask it to work. If we tend to sit with a very rounded spine and we're taking that muscle and stretching it out over a rounded position, and then we move or twist, that's part of it, because that musculature starts at the very base of our spine and goes all the way up to the neck. All of those muscles are very interconnected. So much so that if you have enough tightness in that area, by just standing up straight and looking up and down, if you put your hands in your low back, you can actually feel the tension in your low back change if that area is tight. And that's something we tend to see when there's some muscle strain or spasm going on in the low back, is things are so tight that just movement of the neck can change what you're feeling all the way down in your low back. Best ways to kind of prevent and combat that is to not put ourselves in a position where we're kind of leaving that muscle hanging out to dry, so to speak. So instead of being in those partially bent over positions and then doing lifting or twisting, using our legs to get in those positions, keeping our chest up tall, trying to use our legs to lift, avoiding twisting while we're lifting and carrying things, and moving our feet to lift and carry things. So if I'm taking something from here and I'm going to go put it on this counter, or I'm picking up grocery bags from the floor on the counter to then put away, I'm using my legs to bend down and lift, turning toward the counter, placing them on the counter, and using my feet and my whole body rather than just bending over quickly. Some of that takes a little bit of time to get used to, right? Because we might be in a rush trying to get some of this stuff done. But if the more you practice it, it's like any skill. It gets a little easier. It gets a little easier to do. So avoiding muscle strains in the back really just boils down to using the legs to lift and avoiding the combination of bending, lifting, and twisting. I read something once, basically saying that that's the only time a BLT isn't good, right? Yeah, it's a great sandwich, but it's not good for our spine, right? Bend, lift, twist, BLT. We don't want, we can have it for lunch, but we're not going to do that with our back, okay? Because that's gonna put us in a situation where we could be setting ourselves up for some pain. So that's the muscle strain and spasm. Again, not as common, but definitely something that can happen and cause some pain locally. And if it's bad enough, can irritate some nerves, and that can radiate out to other areas of the body as well. The next two are definitely more common and are more actually natural, right? So that's kind of one of the myths that we're gonna bust here today is disc bulges or herniations and stenosis really aren't injuries as much as they are a natural process that happens to just about everybody as we go through the aging process. But certain imbalances in our body cause more stress to be placed on an area of the spine where those things are taking place, which then pushes on those nerves, which leads to pain. Okay, so let's take the disc bulge for example. I'm going to share my screen again back on that image here. We're all looking at the image with the nerves, right? Okay, good. So you can see where these nerves come out. There's an opening here. The disc is right here. So this is the front of your body. This is the back of the body over here. The disc is right in here. The joint is right in here. There's only so much space right there, okay? Nerves like space, blood flow, and movement. So anytime we restrict any of those three things, we could be setting ourselves up for irritation on that nerve and leading to pain. So because there is room over here, so this is kind of this is the back of the spine, but it's also over to the side a little bit, right? So this, if we're looking at this from the left side, this is the kind of the back and left side of the spine. When we tend to have disc herniations, they tend to go not straight back, but back and out a little bit, because that's where the force pushes them. You can think of the discs in your spine like a partially inflated balloon, okay? If we squeeze on this end, which is what we do when we bend forward and round our spine forward, that jelly material on the inside gets pushed backward, okay? If you bend backward, right, you bend your spine back this way, we push that forward. Most of us live in some sort of a rounded position. Sitting in a rounded position puts almost as much stress on this disc to protrude out toward that nerve as rounding your spine and lifting something, okay? Those are the two most stressful things on our discs that we do in our daily life. So even more so than bending over when we're not sitting, because by sitting, we're putting much more direct stress and force up through our back, which puts this disc at a little bit more of a disadvantage. So again, as we talked about those discs being thick and fibrous, right, on the outside, but as we go through the natural aging process in life, our body loses a lot of its water content, okay? And that weakens that thick outer fibrous layer of the disc over time. So naturally, some of that inner jelly material kind of starts to poke out a little bit anyways, and these discs shrink. That's part of the reason why we shrink a little bit as we get older, is we lose some water content and some jelly content in these discs, and they shrink. So even if nothing pokes out, but they shrink, you could see how this disc shrinking actually shrinks the space where those nerves come out, right? So some people inaccurately call that phenomenon degenerative disc disease. So if you've ever been told that you have degenerative disc disease, don't worry, you do not have this rare disease that only certain people get. A very high percentage of people have that over time. In fact, once we get into our 70s, about 70 to 75% of people have shortening and degenerative discs. When we get into our 80s, about 80 to 85% of people have it. It kind of matches the decade you're in. So 40s, 40% of people, 50s, about 50% of people, 60s. It's a natural process that goes on. Some people get it earlier in life, much earlier than others. Maybe we could classify that as degenerative disc disease, but in general, it's really not a disease. It's more of a byproduct of natural aging, okay? So people hear that disease and they go, oh no, I have a disease. And they think there's nothing that they can do about it, which isn't entirely true. So ultimately what happens is whether our discs shorten or whether they shorten and have some of that inner jelly material poke out to where this nerve is, if they start pushing on this nerve, that is what causes pain. And it can cause pain locally right here in the spine, or it can cause pain anywhere along the line that nerve travels as it goes out into our body, like the sciatic nerve, okay? And it really depends on where on this nerve it pushes. Now, it's very, very possible to have a disc protrusion that comes into this space right here that does not cause pain at all. And in fact, anywhere from about 40 to 65% of people, and even a little higher, the further we go in age group, have things like disc bulges and arthritis on an MRI or degenerative disc with no pain whatsoever, which means it is entirely possible and very, very possible, somewhat very likely, to have those things and never get pain ever in your life. That's also why I don't suggest people run right out and get x-rays and MRIs of their spine, because we can often treat these things without that, just by looking at what types of things in your life cause the pain, what type of imbalances are showing up in your body that lead to pain, lead to more stress being in place on that area, which leads to pain. You know, that imaging usually doesn't tell us the whole story. Sometimes it's necessary because of what's going on, but oftentimes when it's pain is simply the problem, that extensive imaging is not always necessary. So with disc bulges, the types of things that tend to hurt the most when they are causing pain is sitting for prolonged periods of time and bending over. Those are the two biggies. Walking, moving around, lying down, lying on your side, lying on your back probably aren't causing the big problem, but sitting sometimes for any amount of time and then bending over by rounding the back. If you scooch down, probably not as bad, but bending over by rounding the back. Because as we talked about, that's what pushes that disc material further toward the nerve and can be pushing on that nerve and making that pain more noticeable, okay? One of the best ways to correct that, if you do have pain with prolonged sitting and bending over. So let me preface this real quick. If you don't have pain with those things, this wouldn't be something that I would suggest doing. But if you do have pain, definitely with sitting and with bending over, but walking and standing are perfectly fine for you, this is a safe thing to do. What you can actually do is, with your hands on your hips, you can lean back 10 times or so and do that periodically throughout the day. Even if you don't have pain with those things, but you want to avoid it, if you want to avoid it because you do sit a lot, that can be something that you can do. I would say that if you are over the age of 65, you might not want to push into that a whole lot, just because of the next thing we're going to talk about, which is probably more common and could be more because of your back pain. But that's a preventative thing for those that might be watching this recording later. If you're sitting a lot due to work, that leaning back might be a safe way. Now, if you try it and it causes pain, discomfort, then stop immediately and don't keep doing it. But if it's relieving for you or it doesn't cause you a problem, then it's perfectly safe to do. So that's a good preventative thing. Another good general preventative thing, and this is true for anything in the spine, is just changing up your positioning throughout the day. So if we avoid sitting for hours on end and repetitively bending over with a rounded spine, those things are going to be less likely to cause that disc material to protrude out enough in certain areas of your spine to cause stress on that nerve. Everyone doing okay so far? Yeah. Questions or anything popping up as we go? Because by all means, throw it in the chat or unmute yourself and ask a question. But with a lot of this, just changing the way that you're moving and the repetitiveness of some of the activities you do can go a real long way in preventing back pain if you don't currently have it, and definitely helping to lessen it if you do have it. So the next thing we'll talk about is that stenosis. Stenosis is just a fancy word. I'm going to share my screen again here for narrowing of the canal. So the canal where that nerve comes out. The most common reason for that is because of arthritic buildup in the joints of the spine and these facet joints, along with the discs getting narrower, right? Getting the height in that disc getting smaller. Both of those things will crowd that opening where that nerve comes out. Again, both of those things are going to happen to just about everybody as we go through that aging process. But when certain areas of our spine are tight above and below a certain area of that low back, certain muscles around our hips are weak, it causes more stress to be placed on certain segments in our spine. And if those segments have that narrowing going on, they're more likely to irritate those nerves and take more space away from that nerve and cause that pain. Okay. So typically people who have pain in their back or down into their legs related to stenosis or arthritis in the spine tend to have their pain with standing longer periods or walking longer periods. Okay. And that really boils down to the reason for that is, again, the mechanics around your hips from weakness in the hips and having more stress being placed on that area as you're walking and moving around. So we have a question popped up here. When vertebrae, for example, are fused, what does that mean and how does that happen? So good question. Fusion can happen from someone having a surgery to have them fused, because maybe that the irritation on those nerves was so severe that it was causing areas in their legs and whatnot to be numb and muscles to actually stop working. So it was medically necessary to go in there and actually put rods and screws and things like that in. That can even be avoided though. And the quicker that you get on back pain and leg pain that you have before it gets to that point, it can be treated conservatively and you can avoid those surgeries. But that can sometimes happen just due to a very progressed arthritic change happening in that area. So there's so much friction and arthritis that develops in those facet joints that we talked about that the body kind of fuses them up naturally where they really can't move and bend anymore. That can be a source of pain as well, because usually what then happens is areas above those couple of segments and below that couple of segments make up for the lack of movement in that area. And you'll actually get pain from the nerves and the spine above and below that vertebra that doesn't really move anymore in those joints. Because our body's going to find the path of least resistance and still try to move and do what we do during the day. Our bodies are master compensators almost to a fault. So it's nice because we keep moving, but it can get to a point where that much compensation and allowing us to continue to move actually leads to more pain over time if we don't address some of those root causes. Okay. Did I answer your question? Yeah, good. Wonderful. So when we're talking about stenosis in that area causing pain, standing longer periods and walking longer periods is usually the reason, the activities that put more stress on those nerves that don't have the room that they need and causes pain. Some of the things to work on to prevent that from happening are a real great stretch you can do is in a seated position. You can actually kind of lean forward. This would be a time when doing an activity like bending and bending over in a seated position is actually going to feel good. Another sign that that might help you is if you walk around and it causes pain, but you go to the grocery store, and when you grab the grocery cart and lean forward on the grocery cart, you can walk through that whole store without pain. Okay. That is a big key to say, hey, maybe bending forward and stretching forward in a seated position is actually going to help me in this situation. So in a seated position, you can actually lean forward and kind of prop your elbows on your knees a little bit. And then as you're able to go and gently increase that stretch, you can actually kind of reach your hands down your legs towards your ankles and do just a nice bending forward stretch. You want to stop when you start to feel a stretch. And when you come back up, you want to use your hands to walk back up your legs. Okay. Don't be in that bent position and try to pull yourself back up, because guess what that's going to do? Give you a muscle strain, like we talked about at the near the start of this. But that can be a nice gentle way to open up around those nerves and make those nerves feel a lot more comfortable and give them a lot more space as well. Again, other ways to prevent things like that is to keep your back and your legs moving. Keep yourself moving. Try not to do too much sitting, standing, or laying in one place during your day. And this is kind of throughout life. With this stuff, varieties, they say variety is the spice of life. That's true for your spine as well. If you're doing different things throughout your day, you're not constantly in the same positions. If you're a person that for work, you have to sit a lot, give yourselves opportunities to get up and move around at least once an hour, once every 45 minutes. If you can get a sit to stand desk at work, even better. But even just during your day, making sure that you're not sitting in one place too long so that the spine and the hips don't get too tight in certain areas and get too weak in other areas, which can then lead to more stress being placed on that area and cause pain on those nerves as well. So again, switch up the body mechanics, switch up what you're doing. That's really the number one rule for any of these problems, and just give that spine the support it needs to feel better in the positions that might be contributing to your pain and discomfort. No problem, Evan. Glad you could join us, rejoin us. So those were some of the big things I really wanted to go over. Some of the main contributing factors that lead to those three most common injuries in the spine. The fact that they can all be treated conservatively, and the sooner the better. Even if you're that type of person who has that off and on pain, like my back will bother me for a couple of weeks, maybe kind of goes away on its own, and every few months it kind of happens. I see way too many people that they have that going on, and then we fast forward a couple of years and they get it and it doesn't go away. and they're trying some of these different things, and before you know it, it's a few months down the road, or maybe even a year down the road, and they're still dealing with that pain, and it's progressed, and the nerves are more irritated. It's now going down into their legs, and now they're like, oh no, what do I do? This is getting worse. It's not getting better. So with anything, but especially with back pain, the sooner we address those imbalances that are happening in the body that are causing more stress to be placed on that level or that area of the spine that might have some very natural things going on that then cause those natural things like a disc bulge or stenosis to then lead to pain. If we address those imbalances, which is usually a combination of areas that are too tight and areas that are weak and unstable, we can take enough stress off that area to treat that pain and give you ways to prevent it from coming back. The sooner the better, but it's never too late to try conservative treatment so that you can progress into long-term care of that treatment, of that injury as well. None of what we would do conservatively is going to completely take away the fact that your discs are shortening, or the arthritis is there, or there is a bit of a disc protrusion. No one can take that away. And even with surgery, they can go in and clean some of that stuff up. But if we don't then also address the imbalances that are present that likely led to that problem, some of that stuff can come back. And I've seen many people who have had very successful procedures that within, months to maybe a year are having some of that stuff pop back up again. And long term, it's not as successful as they thought because those physical imbalances in other areas of the body weren't addressed. And again, even at that point, there can be improvement. But the sooner we address those things, the better. The better. So those are my big take-home points. I want to go into a little Q&A, and make sure you stay on with that Q&A because someone could definitely have a question that you didn't think of or that pertains to your situation. And after the Q&A, I do I always like to give a little gift, a thank you to the folks that are or a thank you and an opportunity for the folks that are here on the workshop today. So we'll go over that at the end as well. So I'd like to open up to any questions that you have. I know we covered a lot. We already had a real good question answered. So what other questions do you all have?
I have a question regarding, strengthening of the muscles around the spine to, help keep that balance.
Mm-hmm.
So that I know I've had many friends over time. It seems as if they can put their back out, just by sneezing, which is really
Or thinking about it.
alarming to me.
Sure.
So maybe Evan, can you kind of address some of the things that you recommend for, stability and, strengthening and stretching?
Yeah, so I mean, for when I work with clients, I actually like to do isometric dominant movements. So I like to do things that like help teach your body how to actually stabilize the spine isometrically. So things like, doing like suitcase carries, bird dogs, side planks, just like basically teaching the core how to actually stabilize the spine when it's put in those vulnerable positions. And maybe Dr. Phil can kind of go a little bit more in detail on what that looks like.
Sure. Yeah. No, those. So a lot of those are what we would call anti-rotational movements because a lot of the muscles that tend to not be activating and working as well in our spine are smaller and deeper and actually attach from segment to segment in our spine, and they help stabilize and move us into rotation. So those are the muscles that usually need to be addressed when we have pain. So yeah, we'd call like what Evan just described anti-rotational or as he said, isometric muscle activation. Sometimes, though, even before we get to that stage, we have to wake some of the core musculature up, right? And that's really a case-by-case basis. There's some pretty good evidence out there that shows us that some of our deeper core stabilizing muscles, such as some of our pelvic floor muscles, there's a muscle at the front of your pelvis called the transverse abdominis muscle. It literally runs from the front of one pelvic bone to the other. It's like almost like a belt across the front of your pelvis, as well as some of those deep rotators of the spine we talked about, and the diaphragm. So all those muscles actually make up your core. It's not the six-pack muscles. Like a lot of people think your core is six-pack. You just gotta do a lot of crunches to get your core strong. But when we break it down to some of what the true core is, sometimes we have to work on just isolating those muscles and waking them up. Because when you're in pain, our body says, hey, what's going on here? We need to quiet some of this stuff down and see what the problem is and gather more information. But unfortunately, our body only recognizes that as pain. It can't, our brain can't determine, oh, it's my disc. Oh, I have stenosis, right? So it tends to shut off. And some of those core muscles have actually been shown to not activate as well, even when you no longer have pain, but have had pain in the past. So you might have had a bout of back pain 5 years ago, but because of the nervous system telling some of those muscles to peel back a little bit and not work and stabilize as well, it still is not firing the way that it properly should. So sometimes before we get into some of those bigger anti-rotational movements or even isometric movements like a plank of some sort, we've got to isolate those motions and wake it up a little bit, because if we challenge it in some of those harder positions, it could be too much and might actually put more stress on the back. If you don't have back pain and haven't really had much of it, those exercises that Evan talked about are great to prevent back pain, for sure. But if you've recently had back pain or currently have back pain, we probably need to start a step or two back before we get into some of those bigger isometric and anti-rotation movements.
Thank you.
Yeah, and I feel like there's also like this misconception, like kind of like what you were talking about, Dr. Phil, where, you know, if you want to have a strong core, you got to do a bunch of sit-ups or a bunch of crunches. But you were talking about earlier, you know, in terms of like, you know, how most people like put stress on their disc in that flexion position.
Yes.
And when you're doing sit-ups, you're literally mimicking that position.
You're just flexing.
You know?
Yeah.
So, you know, it's just something to think about, you know, anatomically wise, that's not really functional.
Exactly. And it can put more stress. So that's actually a real great example, Evan, of a different exercise that would hurt one cause of back pain but help another. So for those of you that are more in that 65 and older category, where stenosis is most likely the main issue of your back pain, doing a more flexion based core program can actually help. It's not necessarily the first thing I would go to, but it is sometimes doing a crunch type position can be a good way to get some of the abdominal muscles working a little bit better, so that while also opening up the area around the spine. So sometimes we use it as almost a pain relief technique for some people, while getting some of the abdominal muscle working, so that we can move to things like Evan said that are a little more functional, that we do in our day-to-day life. So it really, this all kind of leads back to getting evaluated with a proper screen of how you're moving, where these imbalances are, from a professional who can look at where your pain is likely coming from based on what you report to them and what they see in their physical exam, so that the program that you start on is more likely to, or is going to, relieve your symptoms, not put you in situations with exercises or movements that are actually going to contribute to the reason you have the pain in the first place. And if that's the big take home of this, if anything, is, you know, if you don't remember what the definition of stenosis is or the anatomy of the spine, it's, you know, how do you need to actually address all of these areas appropriately to make sure we're not making your pain worse, and we need to identify that correctly.
Yeah, and I think, I mean, when it comes to back pain, I think there's just so many different complexities to it, whether it's, you know, like, you know, if you have like a weak core and there's areas that you need to work on, or if it's just as simple as like just not understanding how to do like a foundational movement, like a hinge pattern, just being able to load the glutes properly to help take the load off the lower back. Just, you know, there's just so many different dynamics, you know, to it, which is why it's, you know, important if you're experiencing any of those things that you get evaluated, you know, and see what's really actually causing the pain, because there's so many different things it could be.
Exactly. Yep. Yeah. You got to have it's a combination of what's that person reporting, what in their life is causing them the pain, what movements are they having the most trouble with, how do they move, and what compensations are we picking up there, and that gives us the idea of where that pain is coming from. So we have another question here related to pain after childbirth and menstruation. Maybe this is more complicated than what we're talking about. How does that work, and is there anything I can do to alleviate that kind of pain? Could be a little more complicated, but just the childbirth part alone, that definitely can be treated, because the lower back and pelvis goes through a lot of changes leading up to childbirth, and then obviously going through childbirth as well. Our body releases those hormones that relax all the ligaments in that area to prepare that area for the child to be delivered, and it takes time for that to then kind of come back a little bit. And if some of these physical imbalances we're talking about, certain areas of your spine being tight, certain muscles in the hips being a little weaker, certain areas of the core maybe not working and activating as well as we'd like them to be, along with all the different stresses that just carrying a baby for 9 months put on your low back and your pelvis, that changes the mechanics of that whole region, right? And a lot of that doesn't necessarily go back once you've given birth. And then if you have multiple children, it happens all over again, right? Usually within a couple of years or whatever, depending on how close the children are in age. And so some of those things are never able to fully rebound, right? So a lot of the things we can do conservatively to treat pain like that is, one, identify, is it coming from the low back or is it actually coming from the pelvis? Because when we talk about childbirth, it could be more of a where your pelvic bones meet the sacrum. So we talked about the sacrum sitting at the bottom of the spine, your two pelvic bones attached to that. There's a joint there. That can be an issue. That area can actually move a little bit in women who have had, either when they are pregnant or when they've had children, especially if they've had multiple children. So identifying what structures are actually causing that pain, and then again, addressing those imbalances to make that whole area more secure. So pain that is more noticeable with the menstruation, that could be more, not as much of a physical presentation. That could be even somewhat more hormonal, and something that you might want to, that someone who has that might want to discuss with a doctor. But the one way to find out how connected they are would be to work on some of those imbalances and see if that would change that process or not. That would be one way to kind of tease that out a little bit, I think. Great. Any other questions? Yes, John.
Yes, you're talking about anti-rotational and when you're doing exercises, if you're doing, like I do a hip to, I get my right elbow to the left hip when I'm
Okay.
doing exercises, and that's a rotational exercise. Is that harmful? I do those every day. I'm at Ocean View. That's one of the things we do during our exercises here every day.
Sure.
And I'm wondering if that's doing harm by the rotational.
Yeah, I don't think working into rotation, if you have the ability to do that, right?
Mhm.
It really is all about a foundation, right? So that's why when Evan was talking about the stuff that he likes to do to help people kind of prevent back pain, because that's what he does a lot with people. They're not necessarily coming in with active acute back pain like they might be when they see me. But if you have a pretty good foundation and you don't have areas of pain already, it's probably okay to do. If you find that it gives you pain, that could be a problem. And it's not something you're necessarily doing, repetitively under a bunch of load on, for hours on end, right? If you're doing that daily or a few times a week, it's probably not harmful. But it's, I guess the real answer is it kind of depends, right? I mean, Evan, what's your overall take on that? I'm sure you work people into some actual rotational exercises, even with a little bit of flexion or extension when it's safe.
Yeah, I mean, ultimately, all these different movement patterns are natural for humans to go through. So, like Dr. Phil was saying, is when you add say external load and stuff like that to the movement, that changes it a little bit. But if you don't do it as frequent and under too much stress to where your body will start responding poorly, then it's definitely fine. But I think you asked if it was did you ask if it was an anti-rotational movement?
Mm-hmm. Right.
Yeah, so basically what anti-rotation is, basically when you're doing exercise that actually prevents rotating. So, say if I had my hands out in front of me and I start bringing, I have a resistance that's trying to pull me to the side. And if I'm bracing, holding that external resistance, that's an anti-rotational movement. Because what you're referring to is more of more flexion based with a little bit of rotation, and anti-rotation, really the goal is bracing the core so there is no rotation.
Yeah. So I had mentioned our spines are very strong, right? They take a lot of force through our day by just holding us upright and doing the movements that they're meant to do. So again, I think if you're doing it correctly at the right level for you and not loading yourself too heavily into that rotation, I don't think it's dangerous. No, we have this somewhat fear, I guess, of doing things that are going to damage our spine, and day-to-day type stuff and stuff that is appropriate for our ability level, and isn't causing us pain, discomfort, and we're not doing it repetitively over and over and over again, is really not going to lead to a lot of damage. And some of those things don't really damage things either. They just tend to bring things up that and turn them painful because they lead to that stress on the nerve where they might not have before, right? So I definitely wouldn't worry about, damaging anything in your spine. And as long as that feels comfortable for you and you're not loading it too much or it's causing discomfort, I think you're probably okay to keep working into that.
Yeah, and I think just in general, when it comes to, even further than just back pain, just really just listening to your body. So if you're doing really any movement, feels good, all right, continue to do it. But if you start to even feel a little bit of pain or discomfort, your brain is very good at sending signals to you, whether it's like, all right, you really just need to stop pushing it, or, it's kind of like the warning before something worse is going to happen down the road. So just listening to your body is really important.
Yeah, definitely. I love that.
So-
did we answer your question, John?
Yes.
Great.
About 5 years ago, I ended up having a cyst removed between L4 and L5 in the disc.
Okay.
What would have caused that? Any
Uh,
idea?
Great question. With things like cysts, they're usually what we would call idiopathic. I mean, I don't think anyone really knows exactly why they might show up in that area or another. But that was clearly something that was taking up space around that nerve and needed to be removed. That's something where surgery is like necessary, right? There's nothing.
Matter of fact, I was living a boat at the time. We did a waterway thing.
Oh yeah.
And so I couldn't get the surgery probably for 2 or 3 days with the
Oh wow.
pain.
Yeah.
And my left leg became numb, and it's still at 5 years later, I don't have all the feeling back. Will that ever come back at all? I lost it permanently.
Could potentially. It's hard with nerve tissue. It's hard. It really depends on how long that nerve was compressed, the severity to which it was compressed, and nerve tissue is very, very finicky. It's a lot easier when it is flared up to keep it flared up and keep it symptomatic than it is to calm it back down. So it is certainly possible that to a degree that could be numb permanently. However, if you were to have some of these other risk factors we're talking about going on, some areas of the hips that need a little bit of attention, a little more stability in certain deep stabilizing muscles, it's not unrealistic that other things in your spine, like some stenosis that's popped up or losing some height in the discs in there, isn't feeding into some of the irritation of that nerve as well. That's one of those things where evaluating that and working on it would be one way to find out if it would help. Doing something like that also wouldn't hurt because it could prevent things from getting worse for you in the future as well. Working into some injury prevention type things. But with nerve stuff, it's very variable. It can take a very, very long time. And depending on the amount of stress it was under over a certain period of time, it could potentially be permanent. Yeah. Really hard to tell. There's no real cut and dry answer for that, unfortunately.
Well, our solution has been exercise. We probably walk around 2 or 3 miles every day. I think
great.
walking is a good exercise for it.
Yeah. Yeah. Motion is lotion. That's
You mentioned earlier about getting the milk out of the freezer, out of the refrigerator like this.
Yeah.
Well, we worked with 2 5-pound weights
Mhm.
every day also, and one of the exercises is to hold those weights out like that.
Yeah. Yeah.
Is that too strainful for the back, or is that actually a good exercise?
No, I think it's fine to work into stuff like that. That was just more of an example of if we put too much load that's too much for you on a muscle that's not in a great position to do the work you're asking it to do, it could lead you to trouble. But if that's something you're working up to, and again, it's not not giving you pain, discomfort, I'm sure you didn't necessarily start with 5 pounds, right? It probably took you a little time to get up there. But yeah, I think that's fine.
Good.
Yeah.
Thank you.
Awesome. Yeah. And the other thing with walking's fantastic, but strength training, because walking is good for the heart. It keeps you moving. But if you don't strengthen some of the muscles, and walking itself doesn't really get muscles stronger, right? We have to work muscles under load through movements that isolate that muscle in a certain way or activate it in a certain way to build strength. So working on some strength through the hips and some stability through the core would definitely help in your situation as well, I think.
When you're talking about weight, are you talking like 5-pound weights? You're talking like 50 pounds or 60-pound weights?
Yeah, no, it doesn't have to be 50 or 60 pounds. Whatever's the most appropriate for you, really. Finding out what's most appropriate for you is that's the key. And it doesn't necessarily have to be weight. It could be your body weight. It could be resistance bands. It could be a combination of those things. Some weight.
Could be your daughter, Phil. Remember that?
Yeah, right. Yeah, I do squats with my daughter sometimes, right? Yeah, like it doesn't necessarily have to be lifting big heavy weights. It can be what we call, and I know Evan does a lot of this, functional movements, either with your body weight or with some added resistance that can target certain muscle groups that you need for good stability and support of your back to prevent that from being an issue down the road.
My wife has sciatica pain, as a matter of fact. Do you have any recommended exercises for sciatica pain?
Yeah, so kind of going back to some of the stuff we've gone over, it really depends on the reason for that sciatica pain. So we would really have to evaluate where we think that's coming from before we recommended an exercise. Because if we do the wrong exercise and it's a different structure that's causing the pain, we could actually feed into the pain. So doing an evaluation is the best way to determine that. Yeah.
Yeah, we do yoga twice a week, and there's a lot of stretching in that. That's probably good for it.
Stretching's not bad, yeah, as long as it's not putting more stress on that nerve. Again, it depends on the structures that are causing it. So if it's something that makes your pain worse, I'd modify and adjust. That pain shouldn't feel worse while you're doing things. We don't want to keep feeding into nerve irritation. So would be definitely something that we can take a look at as well. Any other questions? Kind of burning questions here as we yeah.
So it may not be a quick answer, but it's a question on my mind. Is where's the interface between chiropractic, understanding there's different approaches to chiropractic, and what Evan does, what you do, Dr. Phil. I think you both know doctors, Casey and Bob Winters and their approach. So that's sort of what we're thinking of in the context of this particular question.
Sure. As far as the difference with chiropractic and physical therapy, and knowing the two chiropractors you just mentioned, I think they're, having talked with both of them, their approach is definitely let's work on mobility and sort of synergy in the spine itself, making sure things are moving the right way and not putting too much stress on the nervous system in the spine itself through specific techniques that they're trained for, right? My training is also going to help pain relief in the spine from not only a hands-on and mobility perspective, but also a stability, muscle activation, stability, working into strength perspective. And then Evan, I'll kind of let you talk to what you do and what your expertise is and how that stuff kind of flows into your area as well.
I mean, a big thing of what I do is really just more focused on injury prevention. So teaching people, once they're out of pain, how to start moving correctly. So then like down the road, when they're doing these movements that kind of put them in vulnerable positions, they'll have the strength to be able to stabilize, certain, areas like your spine and hips and all these different areas. So when it comes to like what Dr. Phil works with, which are people that are primarily in pain, usually on like the second in line, in terms of preventing from people to going back to Dr. Phil, then that's
right.
pretty much how it goes.
Right. For the same issue anyways. Right.
Exactly.
Yeah, for the same issue. Yeah. So Evan and I have a good kind of relationship here where in order for people to work effectively with him, if they can't do that through certain pain they're having, I can work them through some of that and get them back to doing that, and vice versa. If I have someone in pain that wants to take things to an even higher level, that's where Evan comes in, and we can work into some of that injury prevention. So there's overlap in all areas. There really are, but that exercise portion of things is less in what the chiropractor area tends to focus on. I kind of have that overlap of the spinal mobility and the exercise, and then Evan's the exercise and maintaining some of that mobility through stretching, and then working into, power and strength even further than where I can take those folks.
Thank you.
Yeah.
Great. Yeah. Thank you. Great question. Any other big burning questions before we kind of wrap things up a little bit? We've covered a lot of great stuff. Awesome. So I talked a little bit about giving you all a thank you. I always really appreciate people spending time with me, especially on a Saturday morning. Really appreciate everyone spending that time. So I always like to offer up. I have a couple spots on my schedule for some back pain prevention and just back pain screenings. Normally those are valued at $180, and I'm doing them for $80. I've got a couple spots that I'm willing to open up. So if that's something that you're interested in, you want to take a look at some of these things, see what your risk factors are. We don't necessarily have to focus on the back. I do these, I basically call them a physical therapy physical. We're going to look at your whole body. If there's a certain area that you want to look at and hone in on and see what your risk factors look like, I'd like to open that up. So if that's something you're interested in, you can let me know in the chat, or you can shoot me an email. You all have my email because I sent you the link to this as well. So definitely let me know. And I'd be happy to take a look at those things for you. But besides that, I think that's all that I had. Evan, I don't know if you had anything else.
Yeah, I have one more thing. So, we talked a lot about the core. So I want to let everybody know that, for those that aren't in back pain right now and are looking to strengthen their core, I actually am giving out a free core program that's really focused on strengthening, the core and, make it less apt for you to get any back pain and just really kind of tighten the stomach, all these great things. So if you are interested in getting the free core program, feel free to shoot me an email at evan@eafitnessandperformance.com, and I'll put my contact information on the Facebook that we did this through. So, but besides that, thank you for joining us.
Yes. Awesome. Thank you all.
That was very informative and interesting. Thank you.
Yeah.
Great.
Well
Thank you.
presented.
Big help.
Nice job.
Yep.
You're very welcome, and thank you all for joining us. And have a great rest of your weekend, everybody.
Thanks.
You too.